Hi, I'm Dr. Stephen Ferguson. I have a large medical practice in eastern North Carolina in a town called Powellsville. Small town, but big things happening here. I'm going to talk about withdrawal today, and particularly withdrawal from opioids, and particularly using a product called Suboxone. Okay? There's lots of other things you can be addicted to out there. You can be addicted to cocaine, you can be addicted to alcohol, but Suboxone works on opioids. That's your heroin, that's your Percocet, that's your Vicodin, that's your methadone. Those are the things that Suboxone will work on. And it works great. How does it work? When you first start doing drugs, say you're doing Percocets. You take one Percocet, it gets you to the place you want to get. Let's put it in two categories. You might be doing it because you had surgery, or you might just be doing it because you like the good feeling. However you got to the point of addiction, you're there. Whichever path you took, whether it's from the street or whether the doctor gave you drugs, you're still there. And so how does it work? When you first start off, you need one Percocet to be effective. Then you need two. Then you need four. Then you might need six. Well, what is that? That's building a tolerance. A tolerance is you're needing more and more and more to get the same effect you used to get when you took one. Now, as you're building the tolerance, you generally won't have withdrawal symptoms once you stop. You'll just kind of want it. You'll have more of a crave. Once you fall from tolerance into addiction, now you're going to have withdrawal symptoms if you stop. So now, if you stop taking your narcotics, you're going to have the achiness in your arms and legs, the nausea, vomiting, the diarrhea, the seizures, the just feeling lousy, feeling bad, want to sleep, not want to do anything. You'll have those symptoms once you reach the point of addiction. So there's a fine line many times between tolerance and addiction. And many times I make the distinguishing point based on whether you have symptoms or not. And some may differ with that. But that's kind of a real basic layman's way of looking at that. So what happens is, as you're building up tolerance, you're developing more and more receptors. Receptors are like, think about the towels on a floor. You got all these towels on the floor, and say you got 2 towels, and you got 4 towels, and you got 8 towels. Well, by the time you're to the point of addiction, you're going to have many, many towels. And those are referred to as receptors. Okay? Now those receptors have to get drug to sit on those receptors in order for you to get the effect that you want, that high, the buzz, or whatever it is. Or just a lot of times once you're addicted, you're not getting high anymore, you're just getting back to normal, or what you think is normal. And once you get clean, then you find out it really wasn't normal for you. So you have all these receptors, and the drugs have to fill those receptors so that you don't have the withdrawal symptoms. That's how Suboxone works. Suboxone comes in and fills in those receptors so you don't have the withdrawal symptoms. And the way I personally do it is I wean the Suboxone down over time, shrinking down the receptors so that by the time we're done, you don't want the drug, you don't need the drug, and you're not going to have withdrawal when we stop the drug. And I think about it real simple, like musical chairs. I'm going to keep taking a chair away until somebody wins. And that's the way I work with the medicine. I keep decreasing the dose of Suboxone until we get you off of it. You know, I'm not a believer that once on Suboxone, always on Suboxone. Not a believer of that at all. And getting off the Suboxone is very important to me. When a patient sees me, first thing I tell them in our first interview is that we're going to get you off the narcotics without the pain and symptoms. But we're also going to get you off the Suboxone. Because one of the challenges is if I just leave you on Suboxone, you become addicted to Suboxone. Why would you want to do that? Trade one addiction for another. So I'm sure you don't want to do that. And so what I do personally, and I'm sure many other docs around the country do the same thing, is they wean you off of your Suboxone slowly so that you're not having symptoms. We go from one dose to the other dose. Some people will go down 2 milligrams at a time. Some people might go more. But I usually weigh it out with the individual patient. But whoever the patient is, I go slow. And I go down slowly. We wean slowly so they don't have the withdrawal symptoms. It's so important that you trust the doctor you're working with because they want you to be successful. I know I want you to be successful in this process. You know, when a person comes in, I tell them this is a partnership. I tell them I don't like to lose, so if you're ready to mess around, you're at the wrong place. We need to do this. We got to be consistent. You got to take the medicine like I describe it, not up and down, not the way you want it. Some of those of you that probably listening to this that have a problem with addiction know that you just take your medicine helter skelter. If you got 10, you take 10. You got 5, you take 5. You got 2, 8, whatever the number is. No, 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 no. In our program, we wean it slowly, but we wean it so that you don't have withdrawal symptoms. So that's kind of how it works, along with other things that are so important in nutrition and health and exercise and sleep. And I'll talk about that on another clip. So check it out. Dr. Stephen W. Ferguson, love to see you. 252-332-6484. You can do it.